So, Pat, in a previous discussion, you had mentioned that prevention of infection was really important to you.
Yes, I am very afraid of getting an infection.
Okay, so on a scale of 1 to 10, 1 being the least, 10 being the most, which number would you say is still?
I still have to say it's a 10.
It's a 10. So there's something specific you'd like to learn about today by the end of our session?
Well, basically, I just want to know how to not get an infection at all. I have a friend who is also on PD, and she did get an infection, and she got really sick and ended up in the hospital. So that is why I am so afraid of getting an infection.
Well, I've worked in the PD unit in the area of PD for several years, and I've come to learn that there are certain things that you can do to prevent infection. And how about we set a goal for today that we were able to name 3 things that you can do every day to prevent infection. How does that sound?
That sounds good.
Okay.
I think I can remember 3 things.
Okay. So the 3 things that we'll have today would be hand washing, wash hands, clean area, and mask. So 3 small things performed every day without exception can help prevent infection. As you mentioned earlier, your friend got an infection, ended up really sick and in hospital, and that's not what you want at all. And also, it can cause a scarring on the peritoneal membrane and cause the dialysis not to work effectively now and also in the future. So the 3 things that you can do every day to prevent infection is hand washing, a clean work area, and to mask. How about we talk about each one in a little more detail, starting with hand washing?
That sounds good.
Okay. So the best way to prevent infection is hand washing. We touch everything with our hands. We have germs on our hands, and then our hands go and touch our transfer set and our twin bags. So washing hands will remove most of these germs. So I know that washing your hands is something that you do every day, but we have a specific way that we like to wash your hands. And I have with a step-by-step guide on how to wash your hands. So let's just go through these briefly. So number 1, you would turn on the tap, wet your hands. Number 2, you would add soap. Number 3, you would rub your hands vigorously for approximately 30 seconds. So that would be saying the ABC or singing the happy birthday song to yourself. Number 4, you rinse your hands thoroughly. Number 5, you dry your hands really well on paper towel. And number 6, you use the paper towel to turn off the taps, and then you discard the paper towel in the trash can.
Okay.
Why don't you read out each step while I demonstrate?
Step 1, wet hands under running water. Step 2, apply an adequate amount of soap. Rub hands for at least 30 seconds. Sing happy birthday or say the ABC. Step number 4, rinse hands very well. Dry hands number 5 with a clean paper towel. And step number 6, turn off the tap with the paper towel and discard it.
So step number 1, we're going to turn on the water and wet our hands under a steady flow of water. Step 2, we're going to apply an adequate amount of soap. Step 3, we're going to lather, wash all surfaces of both hands for 30 seconds, or sort of singing
Happy birthday to you.
Yeah. Okay. Step 4, rinse well under the warm running water. Step 5, we're going to dry hands really well with a clean paper towel. And step 6, we're going to use the paper towel to turn off the tap and then dispose of your paper towel. That was great, Pat. You did a really good job.
Thank you.
So have you thought about where you're going to do your peritoneal dialysis at home?
Yes, we have thought about it. And the spare bedroom that we have is what we have chosen because I can keep all of my supplies there as well. And there is a table desk in there that I can also use. So that's what we've chosen.
Okay, is there a sink close by?
That's the only drawback. It is across the hall and it is down the hall a little way.
So on a scale of 1 to 10, how confident do you feel that you would be able to wash your hands before you do each of your dialysis exchanges?
Well, right now I'm being hesitant, but so I'm going to say a 6.
So, 6. So why would you choose a 6?
My hands won't look dirty, and I will probably, because the sink is kind of down the hallway, I'm going to be sitting at the table with my stuff all ready, and then I'll think, oh dear, I didn't wash my hands after I'm almost ready to do it. And I'm worried about that.
Okay. Let's think about something, or I'll let you think about something that might prompt you or remind you to wash your hands.
Well, thinking about it now, I like sticky notes and little signs that I make for myself for other reasons. So if I would make myself a little sign that said wash hands and put it right on the table with my supplies or right on the table, I think then that would help me to remember. And if I don't remember, I can do it.
Okay. That sounds like a really good idea. So maybe we should try that, and then when we meet up, we'll discuss how that's working for you.
Okay.
Okay? So let's discuss a scenario that might happen at home. So you're sitting in your room, you've got your transfer set out, you've got your twin bag connector, you're sitting there holding just about ready to pull the ring off, and you realize that you didn't wash your hands. What would you do in that case, Pat?
I would be glad that I didn't pull the ring off. So I would just get up and I would go down the hall into the bathroom where there's a sink and wash my hands and come back.
That's good. That's exactly what you would do. So at the beginning of the session, there were 3 things that we thought would help prevent infection. Can you name those 3 things to me, Pat?
A clean area, a hand washing, and a mask.
Good for you. That's exactly what we talked about. So I know this is a lot of information to take in right now. We've done the hand washing. And so what I think we should do, because it's quite overwhelming to have all this information all at once, is we'll take a 15-minute break. Then we'll get back together again and we'll go into the clean area and wearing a mask in a little more detail. How does that sound?
That sounds good.
Okay, Pat, we'll see you in 15 minutes.
Okay.